Langya Henipavirus was first discovered in late 2018 in China. The virus was identified during an investigation of febrile illness in humans in the provinces of Shandong and Henan. However, it wasn't until August 2022 that the discovery was formally reported in a study published in the New England Journal of Medicine. The virus is related to other henipaviruses like Hendra and Nipah viruses, and it was detected in a number of patients who had close contact with animals, particularly shrews, which are believed to be the natural reservoir of the virus. The primary suspected infection route of Langya Henipavirus is zoonotic transmission, meaning it is transmitted from animals to humans. Shrews are believed to be the natural reservoir of the virus, as they have been found to carry the virus in a significant proportion of the population. The exact mechanism of transmission from shrews to humans is not fully understood, but it likely involves direct contact with infected animals or their secretions. As of now, there is no strong evidence of human-to-human transmission, though it cannot be entirely ruled out. Most reported cases have been sporadic and linked to individuals who had close contact with animals, particularly in rural areas. Further research is ongoing to better understand the modes of transmission and potential for human-to-human spread. Langya Henipavirus infection presents with symptoms that are similar to those seen in other viral infections. The most common symptom is fever, which is often the primary reason patients seek medical attention. Alongside fever, patients frequently report experiencing fatigue, which is characterized by generalized tiredness or weakness. Respiratory symptoms, particularly a persistent cough, are also common among those infected. Muscle pain, or myalgia, is another typical symptom, with patients experiencing aches in their muscles. Gastrointestinal symptoms such as nausea and vomiting have been observed in some cases, adding to the overall discomfort. Headaches are also frequently reported, consistent with many viral infections. Laboratory tests in infected individuals often reveal a decreased white blood cell count, known as leukopenia. This reduction in white blood cells can make the body more susceptible to other infections. In addition to these symptoms, some patients exhibit impaired liver and kidney function, as indicated by elevated liver enzymes and abnormal kidney function tests. This suggests that the virus may involve multiple organ systems, though the severity can vary. While most cases associated with Langya Henipavirus have been relatively mild, the potential for severe illness exists, particularly given that other henipaviruses are known to cause serious and sometimes fatal diseases in humans. Ongoing monitoring and research are needed to fully understand the range of symptoms and the clinical implications of Langya Henipavirus infection. Currently, there is no specific antiviral treatment or vaccine available for Langya Henipavirus. Management of the infection primarily involves supportive care, focusing on relieving symptoms and maintaining vital organ functions. In cases where symptoms are severe or complications arise, hospitalization may be necessary to provide close monitoring and intensive care. Treatment generally includes symptomatic care, such as administering medications to reduce fever, manage pain, and alleviate other symptoms like cough or nausea. Ensuring adequate hydration is crucial, especially for patients experiencing vomiting or symptoms that could lead to dehydration. For those showing signs of liver or kidney impairment, additional treatments may be needed to support these organs and prevent further damage. Continuous monitoring of vital signs, blood counts, and organ function is essential to detect any potential deterioration in the patient's condition and to adjust care as needed. Since there is no direct treatment for the virus itself, prevention becomes especially important. Efforts to prevent infection include minimizing exposure to potential animal reservoirs, particularly shrews, and implementing public health measures to reduce the risk of zoonotic transmission. Ongoing research aims to better understand the virus and eventually develop targeted treatments or vaccines.